Hello and welcome to the AHN Eye Specialist. I'm Dr. Hodkin and I have been performing eye surgery here since 1994. We have a very experienced and dedicated staff and I hope you'll find this a pleasant experience. This video was made to inform you about the basics of cataracts and cataract surgery. During your exam we can talk more about your individual situation and I can answer any questions you may have. Cataract surgery happens to be the most common surgery performed in the U.S. and has an extremely high success rate. However, any medical procedure does have risk, and you should not undergo the surgery unless your decreased vision is interfering with your life in some way. We'll start off with a brief description of the eye and how it relates to cataract surgery. The very front surface of the eye is called the cornea, which is clear like a watch crystal. Light coming in through the cornea is focused towards the back of the eye. In fact, the cornea does most of the focusing work of the eye. If your cornea happens to be curved more in one direction than the other, you have what is called astigmatism. In other words, most corneas are round like a basketball or the back of a soup spoon. But if instead your cornea is stretched more in one direction, like that of a football or the back of a tablespoon, this unequal curvature blurs your vision and requires glasses or contact lenses to correct. Behind the cornea is the colored part of the eye known as the iris. The dark opening in the center of the iris is called the pupil, through which light enters the eye. Just like in your exam today, we use drops to dilate the pupil to prepare the eye for surgery. If you happen to be on a medicine called Flomax or a similar medicine, or have ever taken any in the past, please make sure and let us know, since Flomax can prevent the pupil from dilating properly. Flomax is used to help with prostate problems and is even used by women for bladder conditions. A poorly dilating Flomax pupil can make surgery more difficult, but if we have some warning, we can prepare for it ahead of time. Just behind the iris is the lens of the eye. Along with the cornea, it focuses light onto the back of the eye to provide clear sight. When we are born, the lens is clear like glass, but with time it turns yellowish brown and blocks some of the light coming in. The discolored lens is called a cataract. If a cataract is not removed, eventually it turns chalk white, like commonly seen in third world countries or even with older pets. At this point, the vision would be extremely poor. To remove a cataract, an ultrasound device is inserted through the side of the cornea and is used to break up the cataract and vacuum it away. A lens implant made of a clear, flexible material is placed into the bag left behind. Once removed, cataracts cannot grow back, but months or years later it's common for the bag holding the lens implant to become cloudy. Fortunately, this is easily treated with a YAG laser. We use a laser to create multiple small openings in the bag, which connect to form a large central clear area. The middle of the eye is filled with a jelly-like substance called vitreous. It's a protein that's similar to raw egg white. The vitreous turns partially to liquid as we age, and the solid particles floating in the liquid are seen as floaters. You may have noticed these more as the years have gone by. These floaters can be more noticeable after cataract surgery since the cataract is gone and your view is better. Floaters are more noticeable when looking out against a bright background, such as looking out a window on a sunny day. The very back of the eye has a light-sensitive lining called the retina. The retina is just like the film in an old-fashioned camera or the computer chip in a modern camera. As mentioned earlier, a clear cornea and lens is required to focus light onto the retina to produce a clear and sharp image. Sometimes an age spot has formed on the back of the eye, a condition called macular degeneration, which blurs and distorts the central vision. Unfortunately, removing the cataract cannot reverse this retinal problem, but can improve your side vision as well as overall color vision and brightness. The retina is a delicate part of the eye and can swell after cataract surgery in some patients, especially diabetics, and this can cause blurry vision. This is called macular edema, but can usually be reversed with drops or other treatments. The problems that cataracts cause are similar to a dirty windshield in your car. The overall vision is blurred and dim, which glasses cannot improve. Patients often complain that they can't see road signs very well, or that reading is more difficult, and golfers state they have trouble following the golf ball. Colors are dull, and some patients even think their televisions need replacing. At night, halos or starbursts are seen around lights, or double vision called ghosting may occur. Because both eyes may have developed cataracts slowly over time, and because both cataracts may be equally advanced, it may be difficult to appreciate what you've been missing until after one of them is removed. Now, the power or strength of the lens implant that is placed in your eye is based on several measurements we take during your exam. Our goal is to make your distance vision as good as possible without glasses, but your body's healing response will determine the exact result. In any event, even if your distance vision ends up being perfect without glasses, you will still need glasses to see up close, such as for reading. This is because the lens implant is not capable of focusing like your natural lens was. Rarely, some folks like one eye set for distance vision and the other eye set for close vision, if they have done this before with contact lenses. This is called monovision and can be duplicated with lens implants. By the way, if you happen to wear contact lenses and are wearing them during today's exam, or took them out just before the exam, make sure and tell the nurse. Recent wearing of contacts can throw our measurements off, and we would need to repeat the measurements after you've gone without them for at least a week. We mentioned earlier that normally chances are very high you will need glasses after surgery, at least for reading and possibly for distance as well. However, there is an option for reducing or even eliminating the need for glasses after surgery. You can choose to have what's known as a multifocal lens implant. This has a success rate of about 80% for achieving both good distance and near vision without glasses. Even if you get this implant and still need glasses for some tasks, you will still be less dependent on glasses compared to someone who received a normal implant. Briefly, the important facts to know about a multifocal implant are: number one, there is an extra cost involved, about $2,000 per eye, which is not covered by insurance. And number two, because of the way the lens implant is designed, it may cause some halos or glare around lights at night and loss of some sharpness of vision, especially in low light conditions such as fog. The other implant option concerns correcting any astigmatism you may have. Recall we talked about some folks having unequal curvature of the cornea, which requires glasses to correct. These folks have the option of what's known as a TORIC implant, which has the correction built in. The advantage of this implant is to minimize or eliminate the need to correct the astigmatism with glasses after surgery. In other words, distance vision would be better without glasses than if the normal implant were used, since the implant itself is correcting the astigmatism. However, the toric implant is not a multifocal one, so you would still need glasses for near or reading vision. This implant is less expensive than the multifocal one, about $1,000 per eye. Remember, with either of these special implants, there are no promises for perfect glasses-free vision after surgery. The final result depends on your healing and other factors. If you're interested in either of these specialty implants, we can talk more about this during your exam. Cataract surgery is done as an outpatient in the surgery center. You do not have to go to the hospital. We don't have to put you to sleep to do the surgery, but we do start an intravenous line and give you some light sedation, similar to other outpatient procedures. We also dilate the pupil and numb the eye with drops. Because of the IV sedation, you need a driver the day of surgery and should not drive for about 24 hours after the surgery while recovering. The surgery itself takes about 20 minutes, but you will be in the building for about 3 to 4 hours total. This is because it takes some time to get prepared and complete the paperwork. The area around your eye is cleaned and a plastic drape is placed over the eye. An oxygen tube is placed beneath the drape near your mouth and nose. A microscope is positioned over your eye and a lid spreader is used to prevent you from blinking. Cataract surgery is not painful, but you may feel pressure occasionally. If you do need to cough or otherwise move during surgery, please warn us so that we can move the instruments away from your eye. As with any surgery, things can go wrong. The worst thing we fear is infection. If an infection occurs in your eye after surgery, it could cause the eye to lose vision. However, this is a very rare event, about 1 in 1,000, and very unlikely to occur. Note that patients with certain medical conditions like diabetes, autoimmune diseases, or cancer are more prone to getting infections from any type of surgery. The symptoms of an infection usually occur within a week or two of surgery and include severe pain, redness, and/or decreased vision. An emergency number is available for you to call if any of these symptoms should occur. Within a half hour after surgery, you can go home and we will see you again the next day for a checkup. The next visit will be about a week after that, and if everything is fine, then the other eye is done the following week. In other words, we do surgery on one eye at a time, about 2 weeks apart. The reason we don't operate on both eyes together is due to a risk of infection. We always want to have one eye untouched as a safety precaution. After the second eye is done and healing well, we will release you to follow up with your local eyeglasses doctor who will fit you with new glasses. The restrictions after surgery are minimal. You can go about your normal life, just don't press or rub directly on the eye. Remember, there are no sutures in the wound, and direct pressure on the eye before complete healing occurs, which takes about a month or so, could open the wound. During this time, don't get any soap, water, chemicals, or dust in the eye. Some minor lifting and bending over is fine as long as it doesn't cause you to strain. Use your eye drops as directed and wear a shield at night for at least 1 week to prevent accidental rubbing or bumping the eye at night. We will start you on eye drops 3 days before surgery to prepare your eye. The drops will continue for about a month after surgery. These are important to use correctly since they will help prevent infection, reduce inflammation, and help your eye heal properly. If your optometrist sent you, chances are that he or she wishes to help care for your eyes after surgery. In that case, and if you agree, we will release you to his or her care soon after surgery when we determine that you are stable. They will follow your healing until it is time to prescribe glasses for you. I think you'll find cataract surgery surprisingly easy, just like you've probably heard from people you know who've had it done. Again, during your exam, we can talk about your specific situation and you'll have a chance to ask questions. Thanks for your attention and choosing AHN.